Hi, everyone. Welcome to our talk on remote educational opportunities in humanitarian aid. I'm Audrey Nguyen. I'm a program director within Health Tech Without Borders. And this talk will focus on the need and applications in this rapidly emerging field and provide some practical steps and considerations for implementing remote education in your own communities and service areas. So here's the agenda. I'll introduce myself, I'll discuss the challenge and why this is needed, and then review some key steps for implementing remote educational opportunities in a humanitarian setting. And this will be discussed within the setting of a case example, specifically pertaining to Health Tech Without Borders' Pakistan flood response to demonstrate how these principles can be applied. So briefly, an introduction. I'm Audrey. I'm a senior medical student at the University of California, Los Angeles, or UCLA, as well as a candidate in the Masters of Public Health program in Health Management at Harvard University. And both during and prior to graduate school, I worked for several years in the digital health space, specifically in a health tech company, as well as in telehealth academic research out of UCLA and Stanford University. And I've also done some global health work at the US-Mexico border. So I'm excited to share with you all this intersection of digital technology and health education. And it's a really meaningful topic for me in particular. So first and foremost, what is the problem and what is the gap that remote education aims to fill? Well, we know that emerging humanitarian issues are on the rise, with climate change related disasters and war leading to displacement of local communities. These humanitarian disasters have forced communities and local frontline responders to rapidly adapt to new and less familiar medical concerns. So for instance, the war in Ukraine has led to increased occurrence of mental health related conditions and acute traumatic injuries, making frontline clinicians who were not necessarily trained in these fields to be able to rapidly learn how to effectively care for these patients. So to help ensure that healthcare continues to operate in these resource-limited settings, technology can help bridge this gap in knowledge and skills. And in fact, emerging humanitarian studies have demonstrated a growing need for educational training in humanitarian settings. So to frame the context of remote education, I'll start with a brief introduction into the case example describing how Health Tech Without Borders leveraged remote educational opportunities within our own programs. So just briefly, in June 2022, there were some unprecedented monsoons in Pakistan that led to extreme flooding. Millions of homes were damaged, thousands of civilians were harmed and killed. And with so many villages underwater and projected to remain so for months, mosquito and waterborne illnesses like dengue and malaria rapidly spiked, along with the incidence of snake bites. And consequently, the nonprofit hospital board at the National Institute of Kidney and Urological Diseases, or NIKUD, connected with Health Tech Without Borders to establish a partnership in developing a remote educational response to serve as one component of the humanitarian aid. So in this emerging field, we were kind of left with this question of, well, how should we provide this remote educational support? In the next slides, I'll guide us through the process of how we approach the development and implementation of this educational response. First, let's take a bird's eye view of remote education, which is essentially using digital technology to teach others and what we're doing now, for instance. And there are several components to consider. First, think of your audience. This could be community members, volunteers, frontline healthcare workers, and importantly, you want to consider what is it that they need. So for example, if they're community members, it could be screening tools or health education on what to do when a loved one is hurt. Next, think of your instructors. Who's going to teach the course? Who is the speaker? The important thing here to consider is expertise. Preferably, you'll want health professionals who are familiar with global health and resource-limited contexts, such as a disaster zone. Third, consider modality. So of course, remote education inherently has the term remote in it, but if you have partnerships with community organizations, or you can physically send volunteers who can arrive in person physically to the disaster zone, you might consider having some kind of in-person component in addition to the remote teaching modules. Lastly, consider synchrony. Do you want your audience to be able to interact live with the instructors, watch the sessions on their own time, or some kind of hybrid approach? Educational videos can typically be helpful synchronously or asynchronously, while skills-based lessons, things like, if you're trying to teach surgical suturing or intubation or something more hands-on, tends to be better live, so you can kind of see the feedback and whether the audience is acquiring the skills that you're teaching. A lot of this also depends on accessibility to internet and whether your audience would be able to set aside time to attend a live session in the humanitarian setting. And then finally, you kind of want to consider geographic location. So if your speakers are on one side of the world and your community members or audience is on the other side, it can be difficult to coordinate a live session, but is still very feasible if that is something you feel would be an important step. Now that you understand the framework, we need a process to build the actual educational curriculum. So here's a guide on how to do this. First, create the primary team. So someone such as yourself should be assigned to lead the project and then coordinate across all the speakers and community stakeholders. Perhaps the most important component of the team, however, is the community stakeholder. So this is the member of the community, the organizational leader on the ground who is most familiar with the disaster zone and the impacted community. And if this is you, that is even better. And then lastly, think of your connections. If you're part of an academic institution that has well-connected faculty or coordinators, you may, for instance, loop them in to kind of help connect you with speakers for the initiative. Next, what will you teach about? From a medical standpoint, what are the most prevalent conditions on the rise? Consulting your community partner and local databases on disease incidents will be very helpful for determining this. Then you'll want to consider your modalities and session plans. And this goes back to the previous slide, looking at the puzzle pieces, detailing what you want the videos to look like. Will they be pre-recorded or live skills workshops? Will they be long or short? It's really up to you and the community partner to determine these and make these decisions. Fourth, reach out to speakers. And depending on how well connected your team is, this could actually be a very easy or a very challenging task. And the most important consideration here, in addition to their global health expertise of the speakers, is to also think about language barriers and cultural awareness. Finally, after the videos have been recorded or are live, decide how you want to disseminate the educational seminar. You'll need to think about what devices are accessible for the community. For instance, if they have mobile phones or if they want to use internet, if telecommunications towers are even functioning during the humanitarian setting. You can also consider things like sending things via email, WhatsApp, if that's an app that is commonly used to communicate. And if you have a website for your organization as well, you can consider using that as a way to share the educational information. So here I'm just mapping that framework we just talked about and applying it to our initiative in supporting Pakistan during the floods. So for us at Health Tech Without Borders, our primary core team consisted of myself, our community partner at NIKUD, which was she's a critical care physician from Pakistan who's on the board of this nonprofit hospital, who is familiar with the community, had recently been there, has family there. And we also had a facilitator or connector who was based at the Center for Global Health, which is a research center located at the Massachusetts General Hospital. And this is our person who was well connected with speakers and really leveraging the connections that we had as an organization with Massachusetts General Hospital, or MGH. In consultation with our community partners at NIKUD, we identified educational topics of interest, including waterborne illnesses, hydration, snake bites, other topics like dermatological conditions that were arising in the setting of floods. Third, we determined the target audience and modality, and this included creating pre-recorded asynchronous 30-minute lectures for clinicians and paramedics at NIKUD Hospital, as well as pre-recorded asynchronous 2 to 3 minute videos for community members. Next, our speakers and instructors, we recruited them with help from our connections within MGH or Massachusetts General Hospital, as well as people outside of MGH at other academic institutions. And we were targeting physicians with experience working in disaster zones, specifically floods if possible. And the videos were in English for the most part, but would be able to be translated to the local languages, specifically Urdu, which is common in Pakistan. Finally, we plan to disseminate the videos using WhatsApp for community members, which is actually commonly used as well. When we were speaking with our community stakeholders, the interesting thing was that a lot of the times community members did not have access to medical care given the floods and the damaged infrastructure, but a lot of them still had phones that were working and were communicating with one another via WhatsApp. So we wanted to kind of use that built-in connection to share this information and the education we were providing. And then finally, for our clinician-oriented talks, we disseminated the information using WhatsApp or using website as well as email to connect with them. So here are some tangible tools you should use to manage your remote educational program. Along with this module, we have some documents and resources that I can share with you to kind of help you get started using these templates. So the first tool you can use is creating a database of speakers to keep track of who you've contacted and when. Second, you'll create a set of guidelines and expectations for your lectures and videos to be shared with the instructors and speakers, and this will help standardize your videos across the curriculum. And in these guidelines, you'll want to clarify how many videos or lectures you want the speaker to give, what topics to cover, whether you and another member will be present when giving the lecture, or if you want them to record it on their own time, if it's a pre-recording. And then the next thing you'll want to consider also is health literacy. So for our Pakistan flood response, we wanted speakers to be mindful of the limited health literacy of villagers. And so ask them specifically to create videos without medical jargon. The third step is some miscellaneous processing. So you can have them send them the videos or pre-recorded talks or lectures to you via email or share it over the cloud. And importantly, you'll want to consider whether you need some time to find and implement like translations. And if speakers have previously created resources or handbooks on the topic, they can also share those with you as well if they're willing to share it. Bringing it back to our initiative, I'd just like to highlight here a summary of the program that we ultimately developed. So for our remote educational curriculum, we recruited physicians with expertise in global health to provide videos on topics ranging from mosquito-borne illnesses like malaria and dengue to dermatological infections. We also created health snapshots or short videos for local villagers on how to recognize when something is wrong and what to do about it, such as recognizing like common snake bites and the urgency of going to the hospital, because many of them were not aware of the severity of something like that. As this curriculum is still being implemented as of today, we're in the processing kind of phase of implementation and development where the videos are being translated to the local languages. And one aspect we really look forward to in the future is evaluating the knowledge gained and satisfaction gained from these remote videos by speaking with participants and getting feedback from them. So lastly, some key tips. First, creating a solution using remote education is really community oriented. It's about doing it for the community and not doing what you think is best for them. So therefore, it's important to work closely with stakeholders and community partners. Another important consideration is that remote education is really only one component of humanitarian aid, and it's not necessarily a great solution in all settings. And so one thing we do know is it's an emerging field. There's no one standardized protocol for doing it, but we do see a growing need for it. And if you and your community partners are considering that this could be something that is very useful, it's important to still try it and roll it out if you feel like the need is there. Next, create an organized plan for development and implementation. And you can use some of the frameworks and tools I provided, like the speaker database, the program plannings, the guidelines, and hopefully find it helpful and adaptable to your current service area. Finally, you'll want to evaluate for the quality of your program by gathering feedback from participants and partners. So just concluding here with some key takeaways, remembering that the purpose of remote education is really about helping the clinicians and the community members adapt to this extremely devastating and challenging time for them. And it's a gap that can be filled with digital technology. The next thing to remember is, again, stakeholders are a key component of developing your plan. You'll also want to consider things like the culture of the community you're serving, as well as the health literacy and the target audience. And then finally, as this is an emerging field, there's so much potential for applications of digital technology in a disaster zone and in humanitarian settings. And there's a lot of potential for growth. So if this is something that you feel is interesting to you, or you want to try it out in your own settings, I encourage you to experiment. I encourage you to speak with the stakeholders and figure out what the needs are and see if there's potentially a gap that can be filled there. Oops. So thank you so much for your time. If you have any questions, please feel free to reach out. And I look forward to wishing you all the best in implementing your service programs. Thank you.